and we are admitting the patients for chemotherapy, immunotherapy. We have an inpatient care for cancer patients, and we have a day care. Some patients we admit for only 1 day, and we take care of side effects. We admit the patients for supportive care for cancer-related side effects, complications. We also admit patients for pain and palliative management. Some patients who are incurable, we admit them, we support them with the medications, with the psychological support, and with the multidisciplinary support.
So setting up a cancer center is a huge thing, and I'm very happy that Victor Hospital has taken this initiative for the state of Goa in putting this effort so that our own people, they do not travel to far off places or to some other states to get a cancer treatment.
Seeing the rampant spread of this disease, we at Victor Hospital decided to launch the Victor Cancer Care Department so that we can be with every patient through their cancer battle. We are looking at a very personalized care right from the time a person suspects or confirms that they have got cancer.
Also more important is the screening of cancers. Because by the time the patients come with malignancies, they are already in the last stage and a very little can be done. So what is more important, what we are focusing is trying to screen these patients and trying to detect them early so that they can be treated completely.
We are going full-fledged to see that patients get the full course of care of cancer surgery. Apart from the surgery, there is a medical oncology department also that is functional. All these patients we know will have some degree of care that is required post-operatively, so that's what we have mastered here.
We have decided that we should do something in this field. Get people aware that cancer can be cured, especially in the initial stages when it is detected and not too late.